Thank you for listening to Plastic Surgery Secrets Talk podcast, where we hear the absolute secret facts about plastic surgery and aesthetic medicine. This is Dr. Jeffrey Spiegel from the Spiegel Center in Newton, Massachusetts, here at Global Aesthetics Conference in Miami. And I'm very fortunate to be speaking with Dr. Flora Levin from Westport, Connecticut, a very, very accomplished and well-respected oculoplastic surgeon. And she's going to help fill us in on some of the most important things that she's learned and you may not know about eyelid surgery. So, Dr. Levin, thanks for coming.
Thank you so much for having me. Those are some high praise. I
Only
I don't know if I deserve it, but thank you very much.
True. So let's start with lower eyelid surgery. It seems that people can often be confused upon, do I have my surgery done from inside my eyelids, outside my eyelids? Do I need a laser? What's the story on lower eyelid surgery?
So I'll tell you my view of the story because the answer may depend on who you talk to. But I think the modern technique is pretty universal. So I am a strong believer that the lower blepharoplasty, when it's done to address the under eye bags and dark circles, should be done from the inside of the eyelid. And whereas in those circumstances where you do it from the outside, most of them do turn out fine and patients do fine, you are taking a slightly greater risk with damaging the muscle and structures that are responsible for keeping your eyelid where it is. So I think the risk of having eyelid not end up in the same exact places where you started is a bit higher with the surgery that's done from the skin approach. So, and I think that risk is really mitigated by going through the inside of the lid. So, and it's just a matter of, getting comfortable with that and skill. So it's definitely something that can be learned along the way, even if surgeons started one way and then wants to transition.
And are you moving the fat into the tear trough when you're doing that?
So most of the time I am. I find that to be a very useful tool because I have viable fat that's alive, that retains its blood supply.
Yeah.
Exactly. And predictable. I think the key to cosmetic surgery is predictability, to end up with the result that you expect. And so being able to utilize that fat, to me, is a highly predictable undertaking. Now, do I often supplement it with fat grafting? Of course, because
it's not always enough.
It's not always enough. Or sometimes you really want to blend that transition between the eyelid and the cheek. It all has to make sense. And that's where that natural result comes in because it all belongs together.
So that was secrets 1, 2, and 3 right there. Secret number 1 is that even if you have the fat from your eye moved into a bigger hollow, it may not be enough. Okay. In fact, if you have so much fat falling out of your eye that you can have enough to fill in these aging areas, that's another problem. And secret number 2 is that you want your cheeks and your lower eyelid to really blend together.
Correct.
And that's one of the secret signs of aging, is you start to see a transition there. So now tell me, if you're going through the eyelid, which is sort of a scarless approach in a way, obviously there's a scar, but it's invisible.
Okay.
What about excess skin on the lower eyelid?
So there are a couple of ways to address the excess skin. And so the way I talk to patients is quality versus quantity. And a lot of times it's a qualitative issue rather than that there's truly extra skin. And when it's a qualitative issue, surgery is not always the answer, in which case we can resort to lasers, chemical peels, microneedling, other means. Now, sometimes there's truly extra skin that can be removed, redraped, etc., to smooth that out, but it's very individualized. It's very common that patients come in asking for a skin pinch. So I think there's a little bit of this public view of the skin pinch being the thing that fixes the under eye wrinkles, and I actually think by itself it's a quite underwhelming procedure in and of itself.
So what's your favorite thing for a lot of excess skin?
So there's truly a lot of extra skin, and it's bad quality skin. I'll often redrape it. So I will create a skin flap. I'll remove a little bit. I'll create a skin flap, and sometimes I'll remove a little more and sometimes not. And I think when the skin heals and it contracts, you actually get a quite powerful improvement in the quality of the skin as well.
I think you're absolutely right. You can't discount the inflammation of healing. And people don't like inflammation. They want to look great immediately.
Right.
But some of the healing you're getting and the tightening is from those processes. We're putting everything in the right place. And that's secret number 3 or 4. I lost count already. It's the body that's healing and tightening things. We're setting it up for the best result, but you can't always be sure. But like you said, you want things that are predictable, and this works very well. All right, what else can influence a person's outcome?
Their outlook, their emotional state.
Microsoft Outlook.
Yeah. Their emotional state, their degree of positive thinking. I really do believe that it's sort of mind and body together. Their relationship with the surgeon. I think those are all very, very valuable tools. Sometimes patients convince themselves that, this is the right procedure or this is the right surgeon because they're famous or, whatever the case may be. But in reality, you have to go with your sixth sense and really feel like this person's going to take care of you. And I also really think people who are positive and are able to sit back and sort of allow the process to carry them to that endpoint are the people who do better than the people who are negative and critical and nitpicking and really allow themselves to make conclusions prematurely before they get to that point where actually it makes sense. It's like judging a whole house when you only have the foundation built.
Absolutely. So that's a very important thing. If you expect good results and believe you will get good results, it's much more likely to occur, especially if you're with a qualified person who wants to help you and you've done your research, you found a good person, and now believe in the person you pick. Stop second guessing yourself. What can a person do to put themselves in a positive mindset?
I think number one, have a good relationship with the surgeon. Know that they have your best interest in mind, that you're one team. I mean, they really want what's best for you. So that's the first thing. The second thing is try not to look in the mirror too much, especially early on in the process. Don't analyze little things. You're looking. Yeah. Oh, absolutely. That first week, it's easy to be positive because you're seeing changes. The second week, once you get into that second month of recovery, I think a lot of times people get discouraged because they are not seeing the final results, but when you're going through it, it feels like it's taking a long time. And so you're more prone to starting to analyze, and it's way too early. You're only halfway through, or maybe not even halfway through.
Absolutely right. Trust and believe. Right. And that's so important. You have to remember that it is only in the best interest of your doctor for you to be beautiful, happy, thrilled, and it is in your best interest too. So trust in the process, believe in yourself, manifest your destiny.
Absolutely.
All right. 100%. So great secrets from Dr. Flora Levin. Dr. Levin, if people want to get in touch with you, how do they do that?
So social media is going to be one easy way. It's Flora Levin MD. Website, drfloralevin.com. Those are going to be probably the easiest way to, yeah.
Okay, fantastic. So thanks everybody for listening to Plastic Surgery Secrets Talk. If you enjoyed what you heard, please listen to all of our other episodes with secrets that you can't believe you never knew, and you will be absolutely empowered to know about. If you want to reach us at Spiegel Center, it's info at drspiegel.com. And we will see you soon, possibly from sunny Miami and possibly from somewhere much colder.